Hi, everyone. Thanks for joining us for our panel session. We have a very interesting group of panelists for you here today. So the people joining right now, so my name is Roberto Sassi. I'm a child psychiatrist and head of psychiatry at BC Children's and the head of the division of child psychiatry at BC, and calling with gratitude from the unceded territory of the Musqueam, Squamish, and Tsleil-Waututh nations in the city also known as Vancouver. I'll ask the panelists to introduce themselves in a minute, but I want to make sure that the audience, you're aware that you can ask questions to the panelists using the feed loop platform or the chat or even the Zoom webinar Q&A. So both options should be available to you. Without further ado, I'm going to ask Mahesh to start introducing yourself first.
Thank you. Yeah, my name is Mahesh. I'm a visitor in this lands. I'm a third-year student at UBC. I'm studying forestry, and I've been a peer supporter for about 2 years at the student recovery community, which is pretty much a safe space for students to talk about substance use, addictive behaviors, and everything in between, but more of that later. Yeah, I have lived experiences with substance use, recovering addict for 3 years last month. And yeah, thank you so much for hosting.
Thanks so much, Mahesh, and congratulations. Dr. Wanshevsky, you want to introduce yourself?
Yeah, good afternoon, everybody. My name's Martha Ignashevsky. I'm an adult, child and adolescent and addiction psychiatrist, and I have the pleasure of working as a senior medical director for substance use and concurrent disorders at BC Children's Hospital and on the complex pain and addiction service at Vancouver General Hospital, and excited to join folks for the panel this afternoon.
Thanks so much. And Dr. Sky Barbie.
Good afternoon. My name is Sky, she, her pronouns, and I'm also calling as a guest on the unceded territory of the Squamish people today, where I work, live, and play. I moved to Vancouver in 2014 as a professor at the University of British Columbia in the Department of Occupational Science and Occupational Therapy, and specifically to help lead the development of a new initiative called Foundry. And so I don't think when we first moved here, we were thinking about overdose at the beginning, but I certainly, that soon became a priority. So now my role is as head scientist at Foundry and really studying the Integrated Youth Health Services Initiative across BC right now in 35 communities.
Thanks so much, Skip. So while we're waiting for questions from the audience, I'm going to start with one that is linked to the name of this conference. I mean, we want to talk about overdose. Let's talk about overdose. So I want to hear from each one of you, what are your thoughts on the openness and the communication about overdose risks? Is that something that are we doing enough? Are we open enough in terms of communication? What are the roles that we can play that would allow communication to be happening more freely? And is that going to have an impact in terms of the overdose risks? So I'd love to hear your thoughts on talking about overdose. Once you start. So Martha, I'm going to put you on the spot. There we go.
Sure. I was on the verge of unmuting myself, so I'm happy to jump in here. I think this is a complicated question and really the focus of the entire topic of the conference today. So I don't think a simple solution is going to be the answer. And I think that a lot is needed here. Certainly, I'm a firm believer that knowledge and education is power, and helping individuals equip themselves so that they can use substances as safely as possible wherever they're on their recovery journey is a really big part of education. And so I do think that we have examples of public service campaigns. When I think back on why we're seeing lower rates of cigarette use and nicotine and even binge drinking in the teen populations, a lot of that comes down to public service campaigns, to education, to messaging that we've been providing. So I think that there is more that we could be doing. I recently on social media came across some posts actually by the BC government talking about services for substance use and substance use disorders, and a recognition that we don't need to be alone. So there's I think opportunities in that capacity, and especially for young people, meeting young people online and on social media platforms where they're at, and also across the healthcare system. I think personally, from my perspective, in order to make a really meaningful difference, we have to stop looking at overdose and overdose mortality in isolation, and we really need to be thinking about building services that are going to address the needs of the individual very holistically. But we also need to think at the initiation of substance use. And I'm a huge proponent of screening and early intervention, because those are interventions that are going to have a lot of downstream impact. So I think there's a lot more that can be done here, both with education as well as with additional supports that we currently aren't doing enough of.
Thanks, Dr. Chevsky. Mahesh or Dr. Barbic?
It reminds me of just the concept of let's talk overdose reminds me of the 1948 definition of health by the World Health Organization, as health being the complete absence of disease and infirmity. And if that's really our definition of health, as a complete absence of disease and infirmity, none of us are healthy. And so it's really this binary concept of health. You're dead or alive, or you're healthy or you're not healthy. And I think just picking up with what Dr. Iggy just said, I love that in your brackets. But what you just said is that if you keep building a system where you're building hospitals at the bottom of the cliff, and you're not thinking about how do we move people away from the cliff, and you're not investing in a system of care that focuses not just on early intervention, I go right back to health promotion and early intervention, working right there together from all ages of development, that this is where we really need to start thinking about not health as a binary thing, or overdose as a, we're trying to keep people alive, yes or no. How do we build a system where people are thriving, and it's built on a system of care that puts the needs of families, young people, patients, anyone receiving care, and communities first, and what are their needs, and how do we empower them to thrive in the communities, with hopefully the goal that overdose doesn't happen, and we're not talking about it in the future. But I think if we only focus on overdose as the outcome, we're going to continue building hospitals at the bottom of the cliff, and we're not going to think about how to keep people away and keep them healthy.
Thanks, Dr. Barbic.
Yeah, no, we know that making noise makes change, right? But also, it's important to notice that we are all here talking about this because we live of this, and harm reduction is like what we do and all that kind of stuff. It's incredibly huge, the amount of people that I've talked to who have no idea, that we're counting death every day, and that hurts a lot. And that's why I feel like the name of this conference is so powerful, because like, we're not just talking about what's going on, we're also like reducing the stigma. I've had conversations with like older folks, and they get mad if I bring up the harm reduction term, or if I bring up the safe supply. It becomes a fight. So yeah, going a little bit closer to your question, it's not time to stay quiet. It's time to scream out loud and count, and just make more noise. Also, this is coming from a student. At UBC we do something called a coffee bike, and we basically just give free coffee to people in exchange of a little conversation. And there's a lot of different ways that we can approach people. And often we come from a place of trying to educate when we try to talk about this, rather than just like, from a compassion point of view, right? Just saying what's going on and not trying to like change, I don't know, minds.
No, I love your comments, Mahesh, and I'm going to link that to some of the comments that are coming on the chat as the next question, where the communication to young people, impression for some of the people in the chat is that it's probably going better than what it is for the parents, or it is for people on the educational system, teachers and counselors and so on at school. I'd love to hear all your thoughts in terms of how to reach out to parents, how to reach out to people outside of the healthcare system, and in particular on the educational system? Is there anything that we should be doing differently, or anything that is working well from your perspectives? Anyone that wants to jump in?
I think this has been the first time sort of politically that I've worked in a province. So I worked in Ontario and Quebec, where you have cross-ministerial collaboration working together. And so you have health and other social ministries working together that include advanced education, Ministry of Social Development, poverty reduction. And we need to keep doing that, and we need to keep fueling that. And this solution would not is not possible on an 18-month election cycle or a 4-year election cycle. We need to co-design a plan where everyone knows their role. And I think today, especially today, since compared to the last conferences, I feel like the role of families and how to build in families into the clinical pathways and into the planning and into the strategic planning has been really prioritized and talked about a lot. But I think all of our roles, we're not sure, we're all trying to do our best sort of individually, but how do we work as a collective whole in a system? And what is everyone's role, not just the family of somebody who's experienced an overdose. At this point, everyone has known somebody who's experienced an overdose in our province. So what is that stigma, Mahesh, that you talk about? How do we all play a role? How do we know what our role is? And how do we work towards this collective outcome that has to be about working together? It can't just be about us all doing it on our own, because it's going to burn everyone out, or it is burning everyone out. But I am hopeful, because I'm starting to see a lot of cross-ministerial, cross-organizational collaboration and coordination. And I think that being, as long as it's led by families and people with lived and living experience and communities, I think that will be the solution of moving forward in a good way.
I think some great ideas here. I would add that, at the time that patients are coming in to see somebody like me, and I'm working with parents, we are getting to the point that we're providing education. We're helping with unlearning around perceptions around substance use. I think a lot about cannabis, for example, and how it's changed over the decades. And so I might be talking to parents or grandparents, depending on who the primary caregiver is, around associated risks and how this as a substance has changed really dramatically in terms of potency from what their experience may have been. And so there's both a process of learning and unlearning. And that can happen in clinical systems and in healthcare. But a lot of the time, these are individuals that have already been significantly impacted. And so I really like this question. How do we reach parents sort of more from an earlier capacity and really thinking about primary prevention? I think that goes back to general messaging about substance use, around, social use of substances. And there's definitely been, big changes even in our low risk drinking guidelines in the last couple of years around messaging that, substance in and of themselves, while they may be used healthfully, safely across the lifespan, there may also be risks associated with them. And so to build that kind of conversation, that kind of awareness and knowledge base, I think is really important. It's tough when we have a primary care system that is established as it is right now, because that would be a natural fit in a lot of these cases, that primary care doctors who have, longitudinal relationships, have touch points with not just the young person, but the parents and the family. They're able to see sort of shifts and positive progress and challenges that arise, and can be a holder of a lot of information. That's challenging to do when there's, several 100,000, if not 1 million people across BC without access to primary care. And so then I think we need to think about our communities. We need to think about our school system. And that's where I think strategic partnerships to prioritize this is really important. And it's, I think, very heartening to have, a young person like Mahesh, who's has been a student at UBC, to be involved and incorporated in topics like this and conferences like this, to be able to help get that message out there that, there can be risks associated with substances. We're in an overdose crisis, but a lot of this messaging starts at home. And so we need to think about that as well.
And I'm gonna link one of the comments on the chat with something that you mentioned, Dr. Barbic, which is to look earlier in the trajectory and look in terms of early intervention and prevention, rather than just building the hospitals at the cliff. I think that's the metaphor that you use. One of the questions was specifically about postponing or preventing the initiation of a substance use for young people, in particular in the context of peer pressure, in environments where parents or clinicians will have very little control over. It might be, groups of friends, it might be with schools, universities. What are your thoughts on the interventions that might be helpful to prevent or postpone, delay the initiation of substance use that we are doing well or that we might not be doing too well?
Mahesh, what are we doing at UBC?
Yeah. So I have a little bit of trouble trying to understand that question because I feel like it goes against harm reduction. Here's what I'm thinking, and I might be wrong, but you know, preventing someone to do something, like, what are we trying to do? Trying to like put in some fear for them to not do it, or because what I'm doing and what we're doing at the UBC student recovery community and what we're trying to do is educate what a substance can do, what like the, possible benefits, possible like outcomes, all that kind of stuff. And, a lot of the people that come to the community, to the student recovery community, doesn't necessarily want to stop using or doesn't necessarily feel that they need to change their, behaviors. We basically meet them where they are, where they at, and whichever their goal is, we will do the best that we can do in our hands to like help them achieve it, whether that is just like smoking only on the weekends and stuff like that, So yeah, we don't talk a lot about like preventing. Only if the student wants to do that, if my peer wants to do that. Yeah. And I can connect that also to like talking, talking about the possible outcomes. Like if it's, and I'm coming from Mexico, which is like, we don't talk much about this. I had no idea what the possible outcomes of specific substances could be, So, and I think if I knew consequences, like realistic consequences, the good ones and the bad ones, I probably would have made different decisions. But yeah, it's interesting to like just challenge what our goal is when we're approaching someone, right?
I think there's a lot of pearls in what Mahesh said, including trying to avoid the use of fear tactics in sharing information about substances. We know from DARE programs or Just Say No programs that were established in school systems that these really didn't have a lot of positive impact in terms of supporting individuals in delaying the experimentation with substances in teenage years, and a lot of that information was not compelling or particularly resonant with teens. There's, out of UBC, there's a group of researchers that have asked that question: how do we actually have these conversations with young people so that this information is compelling, so it is going to make a meaningful difference? And there are extensive prevention programs, I think probably 20 or 30 at last count, that have been developed internationally. And it's less about the specificity of the program and what are the actual elements of the topics that are being presented. And a lot of them have the sort of magic ingredients in them seem to be around that ability to have an open and an honest conversation, a non-judgmental conversation, to be able to provision information, individuals with facts and evidence-based factual information. I'm continuously directing youth, young people, teens to the Foundry website, because there is great information about what substances are, how to safely use substances if you're thinking about that, so you can make an informed decision. But also there's a question in the chat that talks about peer pressure and how to withstand that. A lot of these programs actually help develop tools and skills? How do I ask questions of family members about substances? How do I find information online that is accurate? And is it necessarily romanticizing or painting an unclear picture or a unilateral picture around substances? How do I build that capacity and that self-confidence and that self-autonomy to say no in a moment I don't feel safe to experiment or to try something different? And so I think that those components, there tends to be family involvement, there tends to be individual involvement, and really thinks about the strengths and skills, the characteristics of the individual, that those can then be harnessed. And the conversation isn't around don't or do use substances. It's around making really informed, safe decisions that are in line with your own values, in line with your future goals for yourself, and allows for better communication, better skills, a better ability or a different ability to withstand that kind of peer pressure. And I think that those are elements that are really important when we think about the delayed initiation of substances until the brain is more formed. And then there's a lot around sort of source control and how we get socialized to the use of substances. So that's true for the family unit and societally. So if we've got medications in the medication cabinet, that haven't been used in long periods of time, those tend to be areas that teens first look for substances. And these are going to be substances that are going to be deemed safe because they're prescription, and that may not be totally accurate. They may be a misperception, but there's lots of things that we can do in that way and sort of share some suggestions around. So I think that there's a few different elements around the early intervention and early prevention piece.
I just add one quick thing, Dr. Sassi. I think, so I'm the mom of 2 teenagers, and I always thought it'd be like the super cool mom, all that harm reduction. And now I'm like completely chaotic mom and terrified, and, really just want to put my kids in a box and keep them there until they're 40 and maybe let them out, when that's not obviously a right solution. But, my mama bear instincts are trying to balance what I know in terms of harm reduction, and how I thought I was going to parent about 10 years ago and come into this phase. And I'm not parenting at all in the way I thought. But I think the thing that has taken my parent hat off and putting more of a health services researcher hat on is a successful system that works well is one that has folks who are really empowered with the knowledge about what it is, what their options are, everything that Martha just outlined. And so thanks for referring to the Foundry website, but all of those resources are written by young people and families, for young people and families. And they're written for different types of folks from different types of backgrounds. And so there's one of my master's students is doing some really awesome work right now with the South Asian community, where this is not a conversation between families and young people that would be had in many different other types of cultures. And so there's really unique barriers. And so when that information is pulled together in a systematic way, it's really important that it's written and designed by folks who are going to use it. But also, I just want to put a plug in for, it can't just be in a book or somewhere, on a shelf where folks have to go out. It has to be where they're seeking information. And so, we have things like banning TikTok, as a typical source. Well, there's 136 billion hits about mental health on TikTok, where the average age is about 18, where young people are accessing information about mental health and substance use and harm reduction on platforms like TikTok and Snapchat and Instagram. Because they're not getting it anywhere else. And so they are reaching out. There's a lot of evidence that folks are reaching out. So it's just about really creating that information in a coordinated way, empowering our BC residents to have that information, and then sharing it in a way that we think in conferences like this are tremendous, 1,200 people, but then how do we actually get the key messaging out to the right places, whether it's schools, whether it's developmentally appropriate, culturally appropriate mechanisms, or using multiple different forms of sharing. And it might not be social media, it could be storytelling, it could be not just Western ways of sharing. I think there's a lot of different ways we can share information in a good way.
Thanks. Thanks everyone. Again, this is an exciting conversation. I'm going to throw a question that is coming from the chat that is probably going to make this even more interesting. So again, we're going from individual decisions of understanding, balancing the pros and the risks of using a substance to peer pressure and family support and so on. but there's larger societal forces as well. And one of the questions was about the recent reversal of some of the components of the decriminalization strategy that the BC has implemented over the last year. And now the use of substances in the public spaces being regulated again compared to the way that things were until a few months ago. So I'd love to hear your impressions overall of either one of those policies and your understanding as people involved in the care and research of people with substance use.
Sorry.
Go ahead.
One of the things that I'm terrified about is people using alone. And when people say that, you know, people using in the parks and stuff, you know, by all means, wherever people can see you and wherever people can like reach out in case you need support, you know, that's a step forward, you know. There's been occasions where universities have like condemned the use in like housing or stuff like that. And it's like, you know, I can't remember exactly where it was, but there was this poster saying that if you see someone using, get away and notify authorities. And this, you know, just connecting it with the park thing, you know, how long does it take for someone to like, you know, die? You know, that amount of time, it's like very valuable for people around. So like parks and people using in public spaces, that's a check mark for me, you know, rather than some one thing that we should be worrying about. Because like we all know that it's going to happen somewhere, right? I feel like people are very uncomfortable getting their ideals like challenged. And most of these people are people who had no experience or no close experience.
Thanks, Mahesh.
This is a really complicated topic, and I'm surprised it hadn't come up until this panel, and we probably could talk about it for hours. But you know, the government's job is to make sure everybody is safe, and public safety is the priority. And I think everybody means everybody. And so if you're going to provide this new set of rules that creates quote unquote public safety, then that also should mean we're creating a system of care for people who need the support where and when they need it. And it's not just a one-stop, you know, fits all. It's a system of care that supports the many people in this province who use substances on a daily basis. It's about creating clear access to safe supply. It's about creating safe spaces for anyone to use. It's about creating the educational materials that we need to think about, from prevention to early intervention to treatment. And it's a bit of a crude analogy, but I can't imagine somebody who has diabetes who's like needing insulin, you know, to be like, oh, please, I'm going to run away and go call 911 because they're using insulin. And if they're, you know, taking methadone or they're taking whatever they need to get through the day, and that's what the system has created, that situation where they are going to use in public because they can't get access to housing, they can't get access to care where when they need it, then to me, we tend to really blame the person and we don't think about the system. And I think we have to get away from this idea of blaming and political division. And I think the CMHA for Mental Health Awareness Week has this logo of let's just be kind. And like, what, you know, somebody who needs insulin to survive, we have a system of care to support that person, and not a lot of stigma. There used to be a lot of stigma around diabetes. There's not a lot of stigma around that now. It's like, okay, great. You're getting care where and when you need it, and you need this to survive. How can we get to that point where we have a system of care where you have a substance use disorder, and this is what you need, and this is, you know, what you want, and we're there to support you, and we're also there to support the public safety of all British Columbians, but that includes people who use substances, and we can't exclude them from this legislation.
I mean, I think Mahesh and Sky have done a great job answering this question. It is a challenging one, and there's compelling arguments on both sides. Like Mahesh, I worry about every individual using alone, using in closed spaces, and the risk of death that comes with that. And I think it's also important that individuals have safe spaces that they can use the substances that they need to avoid withdrawal, to avoid the circumstances that come with that. And the general population also needs to feel comfortable and safe using public spaces. So I think that global policies like decriminalization and now the disappointment around recriminalization, I think needs more research around it. What has been the impact? What have been the societal perceptions? Because that's a really huge thing, the perception, and especially with our communication platforms being so sensationalistic and so easily able to be expanded and to reach huge audiences, you're going to find individuals that in echo chambers are continuing to reinforce the beliefs of the individuals that they're talking about. And that ultimately ends up preventing any kind of progress from happening. I think the other sort of challenges here is those of us that do this work weren't really expecting decriminalization to change very much for patients with substance use disorders, at least in the local Lower Mainland. I can't speak about the entire province because at least in the downtown east side, in many ways, functionally, the police were not really prosecuting individuals for possession of small amounts. So this I think what ends up happening is policies that move too rapidly in one direction without really appropriate implementation and really thoughtful planning end up actually worsening the problem. And then we see these societal and social misperceptions around substance use and risk, and then moving 180 degrees in the opposite direction, I think also further serves to reinforce that. So we're dealing with a lot of misunderstanding, a lot of misperceptions, and continuations around stigma and stigmatization, all of which needs a huge push to make a difference. And I think that at the end of the day, individuals, as they're approaching folks who are using substances, continue to view this as a choice, as a moral failing, rather than a really complex disorder that, like diabetes, has the potential of impacting somebody across the lifespan, and no longer becomes around choice when we look around at some of the brain imaging and brain circuitry. So I think ultimately more nuance in these conversations is really needed to both build better public trust and a better understanding of all of this. When we're looking at either extremes, I think we're going to lose the majority of people. And that's really where I see the repealing of decriminalization going.
So I'm loving the discussion, but I'm getting the warnings that we're almost out of time. So I'll try to end with one question that I'm hoping that you can answer with the one word or one statement, if we can. So what is missing in the system of care for people with substance use here in BC? What is the one thing that you could, if you could make it happen as by magic, with the magic wand? What is the one thing that you'd like to do in the next 60 seconds? Dr. Barbet, start with you.
So I'm gonna go last. We got to build the bridges and we have to build the connections and build the playbook, and we need transparent roadmaps about what's working, what's not working, and we need to start becoming a learning health system in British Columbia, so that we don't have a whole bunch of people working on their own, trying their hardest, that we have a system that's working together and doing the best that we can, but also learning and evolving and responding and not being reactive to everything that comes up, but really being proactive and being ready for what's coming our way and being flexible.
Thank you, Dr. Nachevsky. The one thing.
I did three.
Pressure.
I mean, I think we need a more responsive system of care for youth with mental health and substance use challenges, that we can address their needs earlier without the profound wait list that we see, that is able to engage parents. So I'm going to go with a very umbrella term of sort of just a more seamless ability to navigate the care system as it currently is.
And Mahesh, what would be your one wish?
Saying one thing is hard. There's so much bad things going on. Radical speaking, defund 604, You know, there's a lot of misuse of power in our community. The other thing that I can think of is let us save our own, you know, things like closing us dolls and stuff like that happening, you know, we are trying to save our people, and there's a lot of things that are preventing us to do that. I guess I can summarize all of those things with put compassion first, you know.
Love that, Mahesh. And I think compassion is the word of the day. And thanking all our panelists for the fantastic discussion, and really thank you for sharing your thoughts and your candid ideas on how to move this forward. And we'll close now with Casey Dalzell. It's my great pleasure to introduce you to her. In case you don't know, Casey is the Executive Director of Drug Toxicity Prevention and Response at the Provincial Health Services Authority here in the BC, at the PHSA. And Casey, in partnership with the key operational and medical leaders, medical health officers, peer community partners, she's responsible for setting the strategic direction and vision of PHSA escalated drug toxicity prevention and response in alignment with the provincial priorities. And also she is involved in developing and coordinating an implementation, monitoring, quality improvement, and evaluation strategy. The floor is yours, Casey, even though I cannot see your image yet, so I'm not sure if it's something on my end.
Thanks, Roberto, but I can't see my image either. So yeah, I don't know what's happening. I was on the screen earlier. I'm just looking at my video settings, but if for some reason this isn't going to work for me, I'm going to speak. I'm going to be relatively quick anyways. And I think, Mahesh, you pretty much gave us the best last word, which is compassion. So very much appreciate that. I think I have a couple of really important things to do here. And first, I want to announce the prize winners. So Marisha sent me the results from our competitions earlier from the lightning rounds. So for Lightning Talk Block 2, our runner-up is, I think it's Tanise Epp from Carleton University. And then our winner is Isabella Galeo from UBC, Department of Psychiatry. So congratulations for your Lightning Talk Block 2. For Block 3, we actually have a tie for a winner. So this goes to both Abigail Sprakes from Lakehead University and Cameron Eekhout from BCCSU. So congratulations on your tie. And then our e-poster winners, we have a runner-up, and that's Marisha Boyd. Congratulations, Marisha, who's been instrumental in getting this conference off the ground. And our winner is Jenny Seo and Jane Kim from UBC Department of Psychiatry. So congrats. I wish you could see my face because I'm clapping right now. I don't know how this Zoom link thing works on the conference site, but somehow it's not working. So in any case, I do also want to thank, on behalf of everybody involved in the conference, thank you to our sponsors, BC Children's Hospital, the Department of Child and Adolescent Psychiatry, UBC Department of Psychiatry, the UBC Institute of Mental Health, McGill Department of Psychiatry, Foundry BC, and Coast Mental Health. And thank you to all of the over 60 speakers and moderators who shared their perspective, their expertise, and stories for the conference today. I think today was extraordinarily inspiring. And thank you to our conference organizers. And I want to just give a shout out again to Marisha Boyd and Fiona Choi, who I worked with, but I know that there are others who helped to get the conference off the ground. So thank you so much. I know it was literally down to the last minute. So yeah, seeing a few claps there. And then thank you to Dr. Michael Kraus, our conference chair. I think he's definitely a provincial lead in this space and driving change. So very much appreciating opening up this conference as this has been going on now for quite a few years. So thank you. And I wanted to, just before I end on, well, probably Mahesh's comment really, was just to thank all the participants. I think I found today inspiring, but it was the chat and the questions. And I think the ability to listen and learn, that was very inspiring today. And so thank you for the participants who were participating. I think I've been to a lot of conferences where that doesn't happen. And so really appreciate that everybody dug in and listened and was very engaged in the conversation. So with that, I've got a couple words I wanted to say. I think a little bird put my name forward to sort of have a couple final thoughts in this space, partly because I'm ridiculously optimistic. I really do think that we can make a difference. And I see, a lot of the efforts that were presented here today as opportunities for us. I do think we've we have come a long way in the past 8 years and beyond that. And I think we can actually really do things. And I see opportunity, you know, in every speaker's presentation. I think there is change that we can make. And I think it's going to take, you know, people of varying perspectives and viewpoints to come to the table and be willing to talk through and get to that nuance. I think that Dr. Iggy was speaking to earlier. I think this is a complex space. And I don't think that there is one solution. I don't think that there's a silver bullet. I think it's multifaceted. And I think we need to be, you know, really looking for solutions in all sorts of corners, and that every perspective is an appropriate perspective. Every voice is a good voice. Everybody comes to the table with a solution. And I think we need to listen to that and really be open to it. And again, I think it's been mentioned a few times that the conference itself has a really great name, because it really is about bringing together voices and talking. And I agree. I think talk has changed. So yeah, again, I'm very optimistic that we can really do something here. And I do think we've learned a lot over the past 8 years. And so, you know, when the crisis was first brought forward, we may not have had all the solutions. And so we were just trying anything we possibly could. But I think we know more now. And I think the research is pretty evident that there are solutions that we haven't tried and that we can do that. And I think, you know, the highlights, I think, from today were that, yes, there's a conversation that needs to be had for folks to decide what their own recovery looks like and decide what their own goals are around substance use, but that we do need a broader system of care, and that there's a need to focus on prevention and early intervention and treatment, but in an individualized and holistic and integrated way that you know, all parties involved in that recovery journey come together in the way that the patient wants or the client wants. And I do think that there is a conversation that needs to happen around the prevention of trauma and the prevention of addiction and the prevention of mental health concerns as well. And I don't think we've had those conversations enough just yet. I know I stepped into this space because I saw, you know, some gaps around discussions and conversations we need to have and solutions that we need to go. And again, it's moving away from that cliff. I think that's the direction that we're going. So again, I think the title of our conference says it the best: let's come together, let's talk, let's dig deeper and seek understanding. And I think, you know, what we've heard today is we need to bring youth into this space even more. I think, you know, youth have good ideas. Yeah, even the skater influencer conversation earlier, I think that was awesome. We haven't thought of those. We haven't, you know, there's so many other things that we could be doing into this space. And I think there are new ideas, and our youth can guide us in that space, and we can help them become thriving adults. So with that, I think I'm going to wind us down, and I'm going to say thank you for all the wonderful talks and the inspiring day. And I wish you all the best. And I hope to see you soon, even though my face isn't on the screen right now, but I'm sure I will get to see you all in all of these incredible efforts to end the crisis. So thank you all.
Thanks so much, Casey, for the closing words. And again, great to see everyone. Again, we're going to be working together over the next several months in trying to tackle this. And I hope to see you all again in the conference next year. Have a good one.